Hi, it's Karen Smith. We're going to look at some wound debridement, looking at sharp debridement. To begin with, we have our red trash bag for our biohazardous waste. We have our gown that we can put on as far as if someone is on contact isolation, or if we feel that under standard isolation that we need to protect ourselves. Anytime that you're doing a wound assessment, it's great to have on the isolation type gown, because especially if you're doing wound cultures and the wound is potentially infected, then you need to be able to protect yourself. And if you're culturing a wound, then it may be a day to 3 days before you get that culture back to find out exactly what organism the patient has, and you've already touched them in several times. So you've got your mask. You're welcome to wear a cap if you need to. If you have long hair, you need to use whatever hair bows that work for you to get that up, that fits either in the hairnet or is not going to drop into the wound and out of your eyes so you can see, because you can't touch your face while you're doing this. There's a pair of sterile gloves if you've deemed that necessary. You might want them if you were doing particular abdominal work, things in particular areas. And then there is a splash shield, because the likelihood of splashing with debridement is high. You can have this type of splash shield, or they make the masks that have that splash shield up on top. Okay, and so I want to show you a couple of the scalpels that we use. And so when you look at these different scalpels, you'll notice a little bit different on them. Up here on the left, it says 10, 11, and 15. That is the number on the blade. And so, matching up, we have the 10, 11, and 15, and then there's a disposable 15 there. That a lot of times the debridement kits, you can order them with a certain size blade. If your facility uses a number 10, then this is what you're using. It is sharp all the way to the edge and has that larger surface. A number 11 is used in surgery a lot. You can tell that it has that extremely sharp edge. And with that, you have a likelihood of puncture. But if you are shaving down a callus, then you may want that particular edge, because you're not going straight in, you're more shaving like this. And then here is the 15. Now that's a little bitty sharp edge there. Just the tip is sharp. So it's safer as far as the user, because the actual sharp edge is smaller. But if you're doing some particular debridements, that may be a hindrance, or it's only taking a small amount at a time. So that's the typical option for you. Also wanted to just take a look here at these various scissors. That these count as medical scissors, and they just look like your basic scissors, but they do count as medical. The tips on them, you can see one tip is blunt and one tip is sharp. If I say the word bandage scissors, you typically see these. It has a leading edge that is very blunt and then kind of rounded on top. so that if you were going to get underneath a bandage, it would not be pokey to the patient. Whereas if I were to use this one in the same manner, this very pokey side would be against the patient's skin, and you would be easier to poke the patient. These are also considered bandage scissors, not quite as sharp by any means, but they certainly are bandage scissors that you will see them in certain facilities. You really need to have alcohol swabs ready in your pocket if you are using the same scissors on multiple patients. So sometimes people will not take scissors in and out of rooms. Some facilities will give each patient a pair of scissors, but some facilities can use these debridement kits. This is a small debridement kit, and what you typically find in it is a pair of gloves, an alcohol swab, a small pair of debridement scissors, a small 3x3 or 4x4 of gauze, some forceps or pickups as they may be called, and you'll get a 15 blade as this one is. I have added the long Q-tip. In some debridement kits you may be able to get a larger kit that comes with a little drop cloth. It may come with sterile gloves in it, a wound measure, little things like that may be additional. But let's take a look over here at the particular wound that we're debriding today. We determined previously that it had about 25% of necrotic tissue, and that if we wanted to sharply debride this wound, that we need to be able to select what we're going to debride it with. It counts as sharp debriding if you use the pickups. It counts as sharp debridement if you use the scissors, and it counts if you use the blade. Okay. So I'll pull out the little 15 blade for that. Okay. And so when we're looking at the bone, then the only time that we would debride bone is that if the physician had approved that debridement. Most of the time, if it would have to be loose, kind of falling out of the wound for us to remove it. That typically that is used more for a surgeon. If there's a portion of the bone that is not viable, then I will communicate very much so with the surgeon, and that's usually something that they would remove. Up here we have some eschar that we can see if we can get an edge on, and so if you can use your pickups and get under it, you can see if it is adhered or not. Out of your choices, your grip is more of this type grip, and your scalpel grip is more of, you can use it like a pencil, works extremely well. Whatever you need to do to have a very, very light hand. Certainly not this type grip, stabbing type grip. It's more of an artist type brush grip. I've had to, like brushing this way, you can walk around the bed to try to get a better angle on the patient, or you can turn your knife blade over and come this way. If you are working with some patient and it's close to you, you try to trim away from you just so that you don't mistakenly cut yourself. And so you have an option of tangentially shaving the wound and picking up the top portion and trying to shave off a little bit and go in layers where you can see what you're doing. If you get to an undermined area where you can no longer see, that should be the end of your debridement section there. We don't keep cutting underneath an undermined area that we cannot see. So you could either cut that off with the scalpel, or you could lay your scalpel down, pick up your scissor, and remove that portion. And I place that on that 4x4 that I had gotten out initially. I'm checking for bleeding. Typically, if it's truly necrotic tissue, that area is not going to be bleeding, but it is attached to something that is vascularized and it may bleed. So I may be able to examine the wound a little bit more. You need to know when to quit debriding. If your patient starts wiggling and is uncomfortable, or if your hand gets tired or your back gets tired. When you get tired, you end up getting a little heavy-handed. So in that situation, you would need to quit and come back another day, or stand up and really rest. Now all of a sudden, I'm not able to tangentially get that, but I might be able to pick up some small pieces with the forceps. And that is acceptable also. Okay. That I have there. And I have my gauze here that I've been placing the items in, and then when I get done with that, then all of my trash from this will go in the red bag, not the regular trash. Now, I have determined over here that this particular area eschar is very adhered, and I would like for it to get some chemicals in there, so I might ask for an order for collagenase Santil if I don't feel that I can cut that all out today. And so I might actually cross-hatch that area, and that means that I take my scalpel and I will cut lines in that eschar, cut down through it, and checkerboard that area. I'll show you more on the oranges for this area. But if you could cut a checkerboard out of that area, then you could apply your enzyme, which comes in a tube. It looks like a little tube of Neosporin or toothpaste, and put some enzyme on that, and that enzyme keeps working for 24 hours, and then put an absorbent waterproof dressing on it. That would allow you, in order to keep a lot of moisture in there, and so you're utilizing this enzymatic debridement in addition to that autolytic debridement of having it airtight waterproof. And so one of the bandages that we used before one of those soft foam bandages may be one that we select to do. And you can put in your calcium alginate rope for the undermining and all, and you can put that on top of the enzyme that you've used. One of the things that I'm going to mention to you is that this calcium alginate rope is acceptable, but they also make it in a silver product. And when you're using an enzymatic debrider with a silver product, you basically make the silver product not work. The enzymatic debrider kind of gets in there with the silver, and it makes both products less effective. So anytime I'm using an enzyme, that I just put in regular calcium alginate or regular Aquacell hydrofiber as the synthetic partner to that. Okay.